Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Friends, today you have just me doing another solo cast, and this is an addition to our series of What Is That? Today we're going to be talking about the PShot. So what is the PShot? The PShot is a short name for the Priapus shot. And what it is it's a specific trademarked way of using platelet-rich plasma, or PRP, which is growth factors derived from your blood that are actually injected into the penis to rejuvenate the penis. As you can imagine, it sounds a little ouchy, kind of like the O-shot sounds a little ouchy. But we actually, in our practice, when we're performing the PShot and the O-shot for that matter, do a lot of, quote, extra things to ensure your comfort during these procedures. We use a topical numbing cream, and we also use Pronox, which is inhaled nitrous oxide. Most people, when they're using our inhaled nitrous oxide, ask if they can actually take it home. It gives you this euphoric feeling, just takes you into la la land, and most people don't even seem to realize or even mind, for that matter, that they're having injections placed into their genitals. Why would somebody get a PShot, or why would they have PRP injected into their penis? Unfortunately, erectile dysfunction is a really common problem in men. About 50% of men at age 50 have ED, 60% at age 60, etc., etc. Typically, the go-to treatments for erectile dysfunction are phosphodiesterase inhibitors, such as Viagra or Cialis. A lot of men find that sometimes these higher doses of these medications can lead to side effects, or it decreases or interferes with the spontaneity of sexual intercourse. Also, unfortunately, as time goes on, or the disease process goes on, these medications may not work as effectively or may stop working at all. So doing a procedure like the PShot is actually getting to the root of the problem. By injecting these blood-derived growth factors from your own blood in the form of PRP, it actually causes growth or enhancement of the blood vessels, the nerves, and therefore leads to increased circulation in the penis for a healthier organ, increased sensation or pleasure. Because there isn't a drug and we're actually using just growth factors from the patient's own blood, this risk of side effects or allergic reactions are essentially almost unheard of. In fact, I don't know if I've ever heard of any long-term or even immediate complications of having the PShot.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.